smoking, alcohol, and so many harmful medicines themselves will also cause accumulation of free radicals. So many reasons are there behind this degeneration, behind the accumulation of these free radicals. And these free radicals, free because they are circulating all over the body, and radicals because they disturb other chemical reactions. And free radicals are nothing but ions. People from chemistry, they understand what ions are. They are unstable, chemicals, unstable particles, and they want to get stabilized by disturbing other chemical reactions. So these ions, they get circulated in the entire body, and they cause degeneration in whichever place they go. So this is the reason for degeneration in so many parts of the body, not just in the backbone or neck or in the knee joint or in the heel or hip or anywhere. Degeneration can happen because of these free radicals. And even these free radicals can also disturb the immune system. So then what is the solution for this particular back pain and neck pain? Without going for any harmful painkillers or dangerous surgeries or without any recurrence in future, what do we do? Because in our hospital, we are treating this such patients with back pain and neck pain from past 16 years. So what we do exactly for patients with serious problem with, they generally come to us when they get suggested by the doctors to go for surgery. Then they will look for alternatives. But I strongly feel that the moment they identify that they have some kind of degeneration in the initial stage itself, they should come and meet an Ayurvedic food and take some simple medicine, start some yoga, pranayam. All these things will help in regeneration of the cartilage. But unfortunately, they come to us at a very advanced stage. But still, we strongly suggest, say that you should not go for surgery at any stage. Some people, they come on a stretcher. People carry them on a stretcher and they directly admit them in our hospital. Even at that stage, we say don't go for surgery, because surgery, most of the time, it is a very complicated surgery, and so many people are getting many complications. Many people come to us after surgery with severe quadriplegia, like entire part below the neck gets paralyzed because of simple neck surgery. So at that stage also, people come, and it is very difficult for us to treat such cases. So initial stages, if you come then with simple medicines and lifestyle modifications, we can easily reverse this regenerative process. But if you are coming in an advanced stage, what we will do is we will do some cleansing therapies, like panchakarma, in which vamana karma and virechana karma, they help the patient remove each and every toxin accumulated which got stuck in each and every cell of the body. They will be coming out of these cells and they will be removed from the entire body. And it's like it is more like there is some virus in your laptop, and you are not able to remove this virus, and the laptop is very, very slow. And what you will do, generally you will format the laptop or desktop, right? In the same way, it's like formatting your entire system. This vamana and virechana is completely cleansing and bringing the whole body to the base normal stage. So then, yeah, I will answer questions within 5 minutes. I will complete it, and I will take up all your questions, Mr. Shivadeep Giri. And after this cleansing, cellular detoxification helps in stopping the degeneration. But already there is degeneration in so many discs. So what we will do to regenerate? Regeneration is also very important. So we actually say that regeneration is possible with so many therapies. I am showing pictures of few therapies which are external therapies, which will help in improving the circulation, strengthening the muscles, reducing the pain, increasing the flexibility of joints. But these are all external therapies. But actual regeneration happens with some internal therapies called Kalavasti and Nasya Karma, where we help the body to regenerate the cartilage which already got degenerated, in either it is in the lower back or neck or knee or heels or hip or anywhere. And people ask us, is it possible? Is it possible to regenerate your cartilage? Doctors say, no, it is not possible. This is one kind of preconditioning we have, that our body is more like particularly our skeletal system is more like an iron frame, and after some time, just like the iron gets rusted, our skeletal system also will get degenerated, and there is no other way than to replace each and every joint which gets degenerated. That is the only way. That is what we think, and we got conditioned by many people, by the society, even by the doctors, that once your bones get degenerated, you will not be able to regenerate them. That is a wrong notion. But now doctors all over the world, now they know that regeneration is possible. But why did we see? I'm showing you this elephant. Some of you are from Kerala, they might know that they train this elephant in a special way, and the elephant is a very small baby. They will tie this elephant with a particular rope with a specific color and texture, and they train it so well that when the elephant becomes a big elephant, Mada Gaja they say, even if you tie it with huge chains and tie it to a huge tree, it will be able to get free itself by breaking the chain or just plucking out the tree. But if you tie it with that particular color rope with which it got trained, it will not move an inch. Because in its mind, it got preconditioned, it got fixed, it got tuned, auto-tuned that no, I will not be able to move if someone ties me with this particular rope. In the same way, we got tuned that health is not my responsibility. If something happens to me, I have to go to a doctor, and doctor should solve my problem. And if he suggests you have to remove this particular organ, let him remove. Replace it with some artificial joint or something like that. Okay, that is okay. Because I have outsourced my health to the doctor. It is not my responsibility to keep myself healthy. So the regeneration is not something I can achieve even if I try. That is what our preconditioning says. But that is not fact. That is not the truth. Now, all over the world, there are so many research centers working on this regenerative therapy. And from past 5,000 years, Ayurveda is telling that regeneration is possible. In fact, Ayurveda compares human body with a flowing river. Like a flowing river. So we say that you can't step in the same water twice. The river is there, but water is going away. So once you step into the river and pull your leg back and again you step into it, the new water is there. In the same way, all our body parts made up of different cells. These cells, they actually take birth, do some work, and they die. This happens continuously. They take birth, do some work, and they die. Every cell has a specific lifetime. For example, the cells on our skin, they live only for 30 days. So they take birth, live for 30 days, do their work, and then they die. In the same way, cells in the stomach wall, the mucous membrane, the lining, they live only for 5 days. Cells in your blood, you know that the blood cells, they live only for 120 days. That is the reason why you will be able to regenerate your blood even if you donate your blood, because body will make more and more blood cells. And nowadays, you know that people are donating liver also. A healthy person with a healthy liver, he donates half of his liver to a person whose entire liver gets damaged. And both of them, they grow their own liver because these cells, they again and again, they take birth. In the same way, each and every part of the body, for example, if you take our skeletal system, the cells in our skeletal system, they live for only 90 days. So within 3 months, all our, if today I have so many cells, skeletal cells in my own body, after 3 months, not even a single cell will stay in my own body. They just disappear, they die. And I'll get more and more new cells. So theoretically, what I'm telling you, what I'm suggesting you is, within a span of 3 months, our entire skeletal system will get replaced and you will have a brand new skeleton. Then after 3 months, if you take an MRI or X-ray, you should be able to see a new regenerated disc, but that is not the case. After 3 months, there is more degeneration. Why is it happening? Imagine I like this building very much, and after 40-50 years, I have an attachment with this building, but the building becomes very old, and government says I have to demolish the building. I don't want to demolish the building. Then there is some new technology where I will be able to remove each and every brick and replace it with a very super strong brick. And if I replace all the bricks, now I have a brand new strong building. But what if I replace the old brick with another old weak brick, and I replace all the bricks, but still I have a weak building, much weaker building? In the same way, old cells, they die, and new cells, they get produced by the body, but the raw material to produce these new and strong cells, whether it is bone or cartilage or any part of the body, we need raw material, and the raw material is food. And the micronutrients are not reaching that particular part, body is not getting because of so many disturbances inside our body, so many disturbances in our metabolism. So we need to create an environment in our own body so that body will heal itself, regenerate itself. We need not replace anything. We should help body regenerate itself. And that is quite possible. Of course, there is one special therapy called Vahni Karma therapy. Apart from the cleansing therapies, which will stop degeneration, and regenerative therapies like Vasti and Nasya Karma, which will start regeneration, there is this special therapy called Vahni Karma, which is again 5,000-year-old therapy suggested by, first told to us by Shushrutaracharya, who is the actual father of surgery. This Vahni Karma is transferring thermal energy to that particular part of the disc which came out of its place, so that the disc will go back into its place and it stays there stronger without coming out of its place again and again. And this is a wonderful therapy which we practice in our own hospital. It's a very effective therapy. So this is something which we do for patients with advanced levels of back pain and neck pain and degeneration. So we tell them that this first part, the number one is the therapy which we do. Number two is sleeping in time, eating in time, getting up in time, and eating healthy food which will help in regeneration, and avoiding all the unhealthy food items which will cause degeneration. And the third part is keeping your mind peaceful, because mind, if it is getting disturbed, the self is getting disturbed, indirectly lots and lots of free radicals will get accumulated inside our own body, in each and every cell of the body, and this will cause a lot of degeneration inside the body. So it is very important to have a very strong self with self-regulation. Further, we advise prioritizing life, understanding the reality, and then practicing pranayama, meditation, and of course some advanced techniques of meditation and all those things we teach our patients. And of course we also ask them to do asanas and exercises for strengthening the backbone, the lower back or neck region. We have some very good asanas which I will show you right now. So a combination of all these things, 1, 2, and 3, will, in fact, I can probably say that many of my patients, they get an MRI after 1 year of the therapy, and if they regularly follow all these 3, they will see that the disc which came out of its place, it goes back in its place and it will be healed completely. So many of my patients in my village where Manoramaji came, so there so many of them are villagers, are like more like farmers and labor. They do a lot of physical labor, and when they get this problem, they go to a surgeon, and the surgeon says that you have to undergo a surgery, and after the surgery you should not even lift a weight of 5 kgs in a next life. They're afraid of it, though they get this surgery done free of cost in Arogyasri and government schemes, but they don't go for surgery and they come for this Panchakarma therapy. And after the therapy, now many of these farmers, they are lifting 50 kilo rice bags on their back, or bending forward for doing kheti ka kaam, and then they're putting big huge what we call water pots on this head and moving long distance, and all these things they are doing without any problem. So, but this is all one part. This is the part where till now whatever I told you is the treatment which we do. But if it is an initial stage, all you have to do is give proper nourishment to your body, do some simple exercises and asanas, and do some pranayama and correct your lifestyle, strengthen yourself. That's all. So these are some food items. For example, all kinds of grains which are growing nearby in your locality. They are all good for your health. Particularly this ragi. This millet is like very rich in calcium. And then we have sesame seeds which are very good for bones. And then there are so many other millets, grains you should not just depend upon one particular grain like gehu or rice, but you should try all the grains available nearby, and that will give proper nourishment. Eating more and more fruits, taking more and more vegetables, dry fruits like dry khajur and dry dates and dry grapes and badam, anjeer, and akhroat. All these are very good for strengthening our skeletal system. Milk and ghee are also very good. Buttermilk is good. Freshly cooked food, anything you eat, it should be freshly cooked, not preserved food. So all these fruits, vegetables, dry fruits, milk, all these things will, and all the grains, all the pulses, all these things will give enough strength to our body. If the body properly utilizes this nutrition, automatically it will help in regeneration of this cartilage. Of course, you need to avoid fried food, spicy food, oily food, reheated items, pickles, potatoes, pumpkin, jackfruit. Potatoes, pumpkin, jackfruit, banana, they cause more pain. That's why we ask them to avoid till the pain comes down. Solid curd, tomato, non-vegetarian food is not very good for regeneration. So cool drinks, chilled items, processed foods, and preserved foods like jam, sauces, canned food, tin food. Of course, junk food like pizza, burgers, and all other things. Particularly foods which are not freshly prepared, or foods which get sprinkled with all these artificial flavor enhancers. All these things are agents of degeneration. They fuel this. They take this degeneration fast forward inside our body, and they will never help us to regain our strength back. So we need to avoid. Of course, we need to sleep by 10 p.m. and get up before sunrise. It is better to have breakfast before 8, lunch before 1, dinner before 7:30, before the session starts now. Avoid pollution. Try to be in a natural place. Try to breathe fresh air. Doing spinal exercises to strengthen backbone and spinal cord. Regular pranayama and meditation, because pranayama and meditation, they help in regeneration of cartilage and bones. That's proven beyond doubt scientifically that pranayama helps in regeneration. And of course, prioritizing life, which also helps in reducing stress and tension. Avoiding foods grown using pesticides and fertilizers. And this is something which I experience as in my past 16 years experience. When I tell my patients, they say, what is the relation between contributing to the society and getting healed? I can't logically establish this relationship, but I have seen it in my own experience that people who somehow make a difference in others' lives, they easily respond to our treatments and they easily heal themselves. So that is something which I cannot explain scientifically, but that is my experience. Of course, this posture, you all know that wrong posture is the main reason for many problems, not just the back pain or neck pain. So you need to have a proper posture. You can see that all the 4 postures from the left side, they are all bad postures, and only the extreme right posture is correct posture while you are standing. While you are using your mobile phone, using it like this, your maximum damage will happen if you are using your mobile phone like this. You can just keep it like this for some time, but don't use it for more and more time. It causes so many problems. And of course, when you sit before a desktop or computer, you all know that the monitor should be at your eye level, not like this. You should not look at like this. And the angle between the backbone and the thighs, it can be 90 degrees or more than 90 degrees. Like this you can sit. Like this you can sit, but you should not sit like this. Okay. And the angle between the thigh and the leg, again, it should be 90 or more than 90. You can put your feet directly on the ground, or you can put on the table footrest, but not inside your chair. Like this, you should not put them inside. So this is a very wrong posture, particularly people who work for more time before the system. They should always keep in mind, and every 45 minutes you should look at your posture and correct it, or stand and flex your body once, flex and extend your body once, and then sit back and work. If you have some problem in the back, you have back pain, don't bend directly, don't lift weights directly. You have to sit, bend at your knees and sit and take this thing. Don't directly bend, and you might damage your backbone. Of course, these are all wrong postures. Speaking like this and reading in your bed, or using a laptop in your bed, and all are bad postures. These are some exercises which will help in strengthening your back. This is the best position to start exercises. And this is two varieties of Bhujangasana, where you are lifting your back and bending it backwards. Any asana or exercise involving backward bending is very, very good for your backbone, spinal cord. Any asana or exercise involving forward bending like this is bad. Okay, so this Bhujangasana, in the first stage, you are touching the entire forearm from knee to the hands, palms entirely on the ground, and you are just lifting it forward and looking at the wall before you. And in the second stage, you are just touching your palms on the ground, and you are lifting your entire back part, and you are looking at the ceiling. So 2 stages of Bhujangasana. Here is a Shalabhasana, different ways. You are lifting one leg, and then you are lifting other leg, then you lift both the legs, and sometimes you will also lift the head. And in this particular exercise, you are lifting one hand and opposite leg, right hand and left leg, then left hand and right leg along with your head. You are lifting, doing exercise. And this is Naukasana. And again, 2 types, where in one picture you are taking the support of your hands, in the second picture you are not taking any support. And this is Dhanurasana. All these are good because you are bending your back backwards, and it is strengthening your back. And some neck exercises which we all can do. All the people who sit before computer should do these exercises. They are very, very simple. Like bending your neck like this, then like this. Do like this slowly. If you have severe pain, you have to be careful while doing this. Then you bend like this, you do like this. I'm visible, right? My video is also coming, right? I'm just doing the exercise. I don't know whether you are able to see me or not. And then stretching like this. And the next exercise is taking your head forward and backwards like this, then lifting your shoulders like this, then rotation clockwise and anti-clockwise like this. And these are some static exercises where you just press your head like this. You don't go like this. Though you're putting a lot of pressure, you again press your hand with your head like equal pressures so that you will not move, and then opposite side. In similar way, press like this and then press like this, like that you can do. Okay. And there are some other exercises like waist rotation, hip rotation, spinal stretch, and then spinal stretch forward and backwards. Not very much forward, torso twist. So these are some exercises which will help in solving this problem. So now I think I have taken almost the entire time. I will take your questions if needed. 10 more minutes I will take. So thank you for being with me patiently. I think I have given you a simple idea about how to strengthen your back and keep this back pain away from your this thing. So I'll take any question right now.
You can raise your hands, please, if you want to ask any question.
Thank you, doctor, for taking this topic today.
Yeah.
And you have explained everything very well.
Yes.
Some points I know already, but you cleared all the points very well.
Yes.
And if there is a jerk during the traveling, that also affects the bone, means spinal cord.
Yeah, many people say that while traveling, there was a jerk, or I have lifted a cylinder or a suitcase, and since then I started getting this back pain like that. Many people say, and that is a trigger. But if there is already degeneration in the spinal cord, if there is already degeneration in any disc, that particular jerk will, make the disc come out of its place, and it might help. It might be a trigger for compression of the nerve, but that might not be the sole reason. Maybe already the degeneration is there. So if there is no degeneration and still there is some kind of injury or some pain, it will heal itself. Body will heal itself. All we have to do is do some simple exercises and take and it will, applying oil to the body every day will keep our skeletal system very, very strong. Okay. So, but if there is degeneration already, then we have to be careful. And we have to, if the pain is persisting continuously, the pain is there, or whenever there is some strain, the pain comes out again, it shows up. Then you have to take an X-ray or MRI just to rule out this degeneration. If there is degeneration, then you need to definitely consult a doctor and try to regenerate all your skeletal system.
Okay, thank you. Thank you so much.
Namaskar, Dr. Sundaraj. This is Professor Parashar here.
Namaste, sir.
Yeah, sorry I joined late. I just have one or two small points to clear in. You made a mention about this Vamana and Rajna. Am I right? Vamana and Rajna?
Yes.
Was it specifically in connection with the regeneration of cartilage, or was it something which is for the general toning of the body?
Vamana and Virechana is for detoxification, removing these free radicals, endotoxins from each and every cell of the body, which will bring our body back to normal state where it can heal itself.
Okay.
Until and unless these toxins are removed, you will not be able to create that environment inside the body for regeneration.
Oh, I see.
It is more like stopping the regeneration and helping our body to regenerate by bringing it to the back to normal state.
Mm-hmm. So it logically it may be good even for the general toning of the body. Am I right?
General toning, regeneration, rejuvenation, revitalization, whatever you say, it is more like it can reverse the aging process. People they say that after undergoing Vamana and Virechana, they look much younger. So it's not just though it cosmetically from outside you look beautiful, but it indicates that from inside you are becoming healthier.
I don't know. Maybe it may be a little time consuming. What exactly is this Vamana and Virechana? In just 1 minute, in case you can.
Yes, I can. Vamana is removing these toxins through vomiting therapy.
Okay.
But it is not like stomach wash. You drink some salt water and vomit. No, not like that. It is like cleaning each and every cell of the body. So for that, we prepare the body with some preparation medicines, Deepanpachana medicines, and increase the digestive fire and prepare each and every cell for the entrance of this particular main medicine called Snehapana. And this Snehapana we will give for 3 to 7 days. And this Snehapana, this medicine will enter each and every cell of the body, and it will remove these toxins from each and every cell of the body. And then we do some special therapies to bring them all the toxins from their places to stomach. And then we give some special diet. And then one day, after preparing the body for at least 9 to 14 days, we prepare the body, and then we allow the body to remove these toxins by inducing this vomiting. This vomiting actually will happen for 1 hour, 1.5 hour only. The preparation will be for at least 10 days, minimum 10 days. So it is not a simple stomach wash. It is cleaning each and every cell of the body. That is Vamana. Then Virechana is like removing the toxins from through motions, but still again it is not a giving a simple purgation medicine to clean only the intestines. It is for cleaning each and every cell of the body. Again, we do the entire process. We prepare the entire body for at least 12 days. Then on the 13th day or 14th day, we will give this Virechana karma. Someone has raised their hands.
Yes, sir. I'm just giving mic. And in chat, Chandrasekhar sir is asking that whether hot water will help in back pain. Hot water bath.
Yeah,
We'll have to
Actually, hot water is very good in relaxing all the muscles and tendons, ligaments, strengthening the skeletal system. Particularly people with back pain or any pain, hot water bath is very much useful. Particularly after applying hot oil to the body and allowing the body to seep in, and then if you do take hot water bath, it will be more effective. But even a normal, simple hot water bath will be very, very useful.
Doctor, can I speak to you?
Yes, please.
This is Dr. Jayakumar.
Namaste, sir.
Good evening. I'm attending your program. It was a very informative and
Okay.
and, very good actually. But I would like to share with you one small thing which is not relevant to today's program or any program.
Okay.
Because you are interested so much in the natural things, I recently come across one particular thing. I just want to share with you.
Yes.
It may be of any use or may not be any use. There is a place called Coimbatore in Tamil Nadu. Can you hear me, Doctor?
Yeah, I can hear you clearly, very clearly, sir.
Yeah, Coimbatore is a very famous place.
Yeah, that particular place, there is one hotel they started. That hotel, they make everything. There is no fire, no oil.
Okay.
They are not using any stove or any such thing, and they are not using even a single drop of oil. They give all kind of foods what is available today in our house or in the market. I just want to share with you.
Oh, so you mean to say they will not cook? They will just give natural food?
No cooking at all. No cooking at all.
Great.
So that's really something new. I thought I can
Wonderful.
pass
Yeah,
on.
thank you for sharing this information. It's quite interesting.
Even the milk, they are not using the regular milk. They are using some coconut milk.
Huh.
But they are making curd out of that.
Yes. Yeah, many people use this. Vegans, particularly, they make different kinds of nut milks and milk out of this groundnut seeds. That is very good to make curd. Actually, I have eaten it. It's very tasty.
Yeah, curd they are making out of the coconut milk and everything. They are just the natural things they are making use of it. Even the packing, they are using all natural things.
That's very good. Actually, we should visit that place.
No plastic is used. In a systematic way, they do it, and everything is.
Which place in
It's
Coimbatore?
in Coimbatore, in Tamil Nadu.
In Coimbatore, which place? Like any?
It is very near to Pyramid.
Okay. Great.
There is a place called Singanallur.
Great.
It is. They are making it. It is really some good informative thing. I thought I.
Thank you so much for sharing this, sir. It's a really useful thing.
Feel like you can give me your WhatsApp thing. I can pass it on to you.
I don't use
Yes,
WhatsApp,
but
but
only
I
thing
have just now I have typed my email ID, drsundarajpermal@gmail.com.
Yeah,
Therefore,
but the thing is, he gives a talk in Tamil. I don't know how far you can able to grasp anything from
My
the.
manager is a Tamilian. I think we will be able to manage.
Okay, I'll do one thing. I will pass it on the message to you. I am sorry, I am taking your time because there are so many people maybe waiting.
Yeah, Mr. Chandrasekhar is asking Parijata leaves juice for back pain or spinal problem. Actually, Parijata leaves decoction is clearly very effective, and it was the reference was there in ancient Ayurveda books that Parijata leaves decoction is very, very good for spinal cord to reduce back pain and neck pain and other pains due to Vata disorders. So we have many people might be knowing about this Parijata tree. The leaves are very thick and rough in texture, so they are very good in reducing pain actually. And even in Patanjali, we have this Parijata Kwadla Churna, which is very cheap. Maybe 100 grams is 10 rupees or 15 rupees.
Yeah, Dr. Sundaram, I wish I would have attended your session right from the beginning itself. In fact, about 10 days back only, I got a pain in my back. I have been getting it, say once in 2-3 years or something, the lower portion of the back.
Yes.
And obviously, then immediately kind of, reporting to the doctor and some physiotherapy. Of course, not this time. I could not go for the single physiotherapy because obviously I'm not going to the doctor because of this corona thing. So I had to consult some known doctor, orthopedist, and obviously he recommended UltraSet for 2 days, morning, evening. I did get relief applying Volini also, but obviously maybe it is not a permanent thing. So what do you advise me? I'm 75 years old.
Sir, best thing to strengthen your back is to apply oil to your body every day before bath. If you can apply some good oils like Mahanarayan Tail or Balashwagandha Tail, that is very, very good. If you have severe pain, immediately the pain relief also will happen just by taking bath with oil massage and hot water bath. But even simple plain peel oil, plain sesame oil also will help in strengthening your back. Of course, practicing simple asanas like Bhujangasana and Shalabhasana only.
That is important. I believe.
Yes.
Bhujangasana, which you mentioned.
Yes.
This 3 years back when I had gone for the physiotherapy of 10 days, I was advised to do these Bhujangasana and all those things. So what happens is lifestyle, you continue for 2 days and you forget about it, unfortunately. That's the problem. So I think that is very good. When I heard you talking about Bhujangasana and giving all those pictures, it was very good. It's very useful, I believe.
And also pranayama and meditation, they are also very, very effective.
I see.
Regeneration of the skeletal system.
I see. Very nice.
Yeah.
Very nice.
Sundaraj, sir. Mr. Chandrasekhar is asking, without pain also can we take Parijat decoction?
Yes. Parijat helps in so many other ways also, not just for pain. It will help in reducing the excess vata inside the body. Yes, without pain also you can take Parijat. Parijat is very good. But it is a medicine, so maybe at a stretch you can take for 45 days, not more than that. It's not a food item, so you will be a little bit careful. 50 ml of decoction is good.
Thank you, doctor. And Dr. G. Lata Shankar ji is asking for Coimbatore address. She's requesting her address in the chat box, if we can post it.
Okay, meanwhile, can I update?
Yes.
Yes. I was inviting you, Dr. Suchita. Please.
Okay, thank you so much. I have been taking the revised medicine since a week, though I have not got all of them, 2 of them. But what the changes I noticed that my thigh pain, the sensitivity in the thighs and pain has reduced.
Mhm.
And probably the joint pain also, which was already getting reduced, is probably also getting reduced a little further.
You have stopped allopathic medicines?
Yes, I have stopped.
Very good, very good, very good.
Yeah. So the new thing this week has happened is I have got this cold. I thought probably because of cleansing process this might be happening. And
No, but
But-
be careful to keep drinking hot water and maybe hot water with some tulsi leaves and some simple
Yeah, yeah.
dalchini and long.
okay, so I take hot water only, always, almost all the time,
That is good.
except heavy summer.
Yes.
And the other thing is, which I used to also have occasionally previously, this joint pain, shoulder pain. So today I am having shoulder pain starting from my right neck, shoulder, and the hand.
Okay. I think maybe we can discuss in detail after this session.
Right.
And also we will discuss which medicines you have not received and how to get them to your place and all.
Yeah.
So, but be careful with the cold and see if it is not coming down, then we will prescribe some medicine for that also.
Okay. Probably the new thing also can be I started taking cold water bath since last 4 or 5 days.
Don't do that. At least till the pains come down, don't take cold water bath. Cold water bath is good actually, but not right now in your condition.
Okay. All right.
Yeah.
Yeah. Thank
Mr. Rabindra Kumar Rao ji is asking how to overcome pain in calf muscle in left leg. So any muscle, if it is staying in the contracted state and it is not at all relaxing, this flexion and extension is not happening, it's always in a contracted state, then you will feel pain. And something is being conveyed by the muscle that, I'm not getting proper signals from the nerves, or I'm not getting proper nourishment, or I'm being overused or something like that. So you need more and more nourishment to the muscles. And for that, you need to have proper nourishment, good food, and have the food in time. And all you have to do is do nice massage to your calf muscles with hot oil, and pour some hot water on that calf region. That will help in relaxing the entire calf muscle. But some people have a special condition where this particular massage and hot water fermentation, all these things will not help in reducing the pain. It's a different special condition. In Ayurveda, we call it Pindikodvesana, where we need a different kind of approach. So if this massaging and hot water fermentation is not helping you, Mr. Ravindra Kumarji, then you can send me a mail and we can have a discussion on what complete history I'll take, and then I can suggest some medicine.
Sir, namaste, sir. Sir, another question is, sir, not related to today's discussion, sir. Sir, yesterday there was an accident in our campus. A group of honeybees attacked a driver.
Oh.
So he was severely injured, and just around 40-50 stings were in his the face and ear, and he was rolling over the ground, and the attacked the honeybees follow to 300 to 400 meters of distance, and we took to the hospital. Fortunately, we do one thing, that the stings we removed from the forceps. And still today, the face is swelling, and taking medicines and injections in the hospital. So what is the procedure for, like somebody told that if there is a original honey is there, you apply it and it will be some way relaxation. So what is the natural way to avoid this situation? Because in this campus there are 10-20 honeybees, the cells are there, and this is happening. So what is the natural way to, if this accident is there, so how to come out of the situation to?
Yeah, if the problem is not severe, if there are no many complications, then taking turmeric and hot water will help, and of course applying honey also will help. And if there is some pain and infection persisting, then I'm just typing one medicine which will help in removing any toxins from the body.
Okay, sir. It will be helpful, sir.
I'm just writing it. It is available in any Ayurveda shop.
Sir.
So that will really help
As
actually.
a preventive, because it is happening. What is happening? That it is they have made cells in the hostel and in the academic building where the students are working.
Yes.
But we are not we cannot how to avoid the situation.
See, unfortunately, we don't have so many trees and so many comfortable places where they can nicely build their own houses.
No, sir. No, because we have made this environment very green and clean. So
yes.
they have made this.
Yes, they are naturally choose such places instead of polluted places.
But they are attacking. Unfortunately, I was thinking that he could have died. I took him to the hospital. My driving the car, and he was faint almost many times. And so So kindly, sir, please.
Yeah, I have already typed this message, and these things can be kept in the campus so that before you take them to the doctor,
Sir, it is not available, sir.
they are available in all Ayurvedic stores and all.
Sir, in the chat box, it is not displaying, sir.
Oh, sorry.
It has been sent to panelists only, sir.
It is
Oh,
there.
okay, sorry. Sorry.
And to all attendees also.
Yeah,
Needs to be sent.
I'll do that again.
And so it's true for Professor Ponnambalam Jayakumar sir's chat response also. So please send it to all panelists and attendees. Then they'll be having the address which you want to send.
Yeah. So my email ID also I have sent only to panelists.
Yes, that too need to be sent to all. Yes.
So that is grab or biogest, sir. No?
Yes.
Sir. Thank you, sir.
Dr. Sundaraj, this for the back pain, and you said one is the till oil, and which was the other oil you mentioned, Dr. Sundaraj?
That is Mahanarayan Tail, and Mahanarayan Tail is very good in strengthening your back and reducing the pain instantly.
Okay, Mahanarayan Tail. Okay.
I have typed it, and then there is another oil, Balashwagandha Tail.
Okay.
It is more like strengthening, though it is not a very good painkiller. But for regular use, even for kids, we ask them to use this oil for massage for infant babies instead of some Johnson & Johnson's oils. Balashwagandha Tail is very good in strengthening the entire skeletal system, and also for the skin also it is very good.
Doctor, I have sent in my chat the Facebook detail. They can
Yes, sir,
go
I
to
have
the
already
Facebook.
opened it. I have already
Yeah.
opened it.
If you are able to see, because I have to wait till the end to get the address.
Balashwagandha.
So it is going on in the other mobile phone. I will send it to you by your mail ID.
Sure, sir.
But for the participant, they can open the things and see the one.
Yes.
It has been again forwarded to only panelists, sir.
Oh,
It
I'm
needs to be
sorry,
sent.
madam. Okay, if possible, you can make it to participant. Otherwise, I will make it one more. Which one you want?
yeah. You need to select all panelists and attendees before you type the
Okay,
message.
I will do it again.
Yes.
Is there any time? Time is possible or?
Though it is getting late now, but you can send it. Already we have reached it 15.
Yeah.
Because I'm comfortable. I have my
Nearly 40 degrees.
dinner
So,
and I came here. You people have to go and have food.
all of us forget about it.
Okay.
Continuing, we want to get our problems solved, and you are always there to solve them. I think Rachel sir has also got some remedial response from you.
Yeah. Go on, Dr. Manorma. Dr. Manorma.
Yes.
Yes, sir.
Namaskar, Dr. Manorma. Professor Parashar here.
And all, but you joined late.
Yeah, I joined late. So the loss is entirely mine because I joined late.
Everyone is thanking you. Ms. Vanaspali ma'am is thanking you, and Ravin sir is wishing namaste. And
Thank you all for patient listening. And
Yeah.
thank you all the attendees, all the students, faculty members, and all the panelists who are there. Thank you so much.
Thank you
Sundaraj
so
sir,
much. Thank you so
for
much,
your
Dr.
valuable
Manorma.
guidance, so
Thank you
that
so
we
much,
can make
Dr.
our life
Sundaraj. Yeah, thank you so
easy and smooth. So we'll meet
next Friday.
Yeah.
with some of again expert advice from you.
Sure.
Yes.
Again, I forward it.
Yeah. Now we got. Now everyone got that message, sir.
I hope it will be of some use to
It
somebody.
will be definitely useful.
Yeah. I will send it to you. The whole thing
Sure.
is possible to your mail ID.
Thank you, sir.
Thank you, sir.
Okay. Parikshit ji.
Welcome aboard Foravin. Fasten your seatbelts. We're taking off.